Namaste and welcome you all for this day 5 event. So we are celebrating the International Day of Yoga in a form of faculty development program organized by School of Yoga Therapy, Institute of Salutogenesis and Complementary Medicine. And we are happy to conduct this event with all the stalwarts in the field of yoga. And we welcome all the participants and our director, vice principal, and our chief guest for today's program, Praseeda Menon ji. So namaste. And we start with the prayer. Sana Bhavatu, just hands in Namaskar Mudra, just close your eyes, slowly breathe in. Om Sahana Bhavatu, Sahana Gunatu, Sahaviryam Karavavai, Tejasvinavagitamastu, Ma Vidvishavai. Om Shanti, Shanti, Shanti. So namaste and welcome you all once again. So we just start with the short introduction to our chief guest, Praseeda ma'am. So today's session on 6th June, we are having two chief guests. One will be from our Kaivalyadhama, Dr. Praseeda Menon. She is a research officer and she is also a assistant professor in GS College of Yoga and Cultural Synthesis, Kaivalyadhama. And the next speaker by level 30, we have our own Professor Dr. Meena Ramanathan ma'am. She is a vice principal, School of Yoga Therapy, ISCM, SBV, Pondicherry. So Dr. Praseeda ma'am is a research officer at the Scientific Research Department, Kaivalyadhama, Lonavala, since 2013 and conducts research in the area of yoga and mental health. Her research work at Kaivalyadhama has focused on psychological impact of yoga on non-communicable diseases, mindfulness in relation to personality factors, the self-regulatory role of yoga in different cultures, the efficacy of yogic practices in children with intellectual disabilities. She also served as an assistant professor at the GS College of Yoga and Cultural Synthesis, Kaivalyadhama. She has well-published research studies and several conferences presentation to her credits. She is a member of College Academic Advisory Board and its Board of Examination and a life member of the Kaivalyadhama Trust. Recognized PhD supervisor of the College Research Center, affiliated to the Kavi Kulaguru Kalidas Sanskrit University, Nagpur. She is also a co-editor of the Journal of Applied Yoga Studies of Loyola Marymount University, USA. So now I welcome Praseeda ma'am to hand over the stage to you. Please, ma'am.
Thank you so much, Dr. Dayanidhi, for that kind introduction. I'll share my screen now. So I hope the screen is visible to all of you.
Yes.
Thank you so much.
Yes, ma'am.
One moment, please.
Yes, perfect.
Yes. Okay. So first of all, I would like to thank ISCM, especially Dr. Ananda and Dr. Meena, and the whole team at ISCM for giving me this opportunity and making me a part of this international faculty development program. I so much wanted to attend the earlier sessions also, but there's so much going on over here. I've never really missed the webinars of ISCM. But yes, here I am. So thank you so much to Dr. Ananda, Dr. Meena, and the entire team of ISCM. And with your blessings and with your guidance, I would like to start sharing a few things that we all could share with each other. So today I'm going to tell you more of a story and then lead you to some of the output of that story, and then we can try and make sense of the title for this particular FDP of yoga therapy in healthcare and educational settings. So this will be the overview of my talk today. First, I'll be talking about the yoga and yogis in colonial India. And I would also love if you have, some of your own thoughts to offer and we interact a little bit before we carry on with the whole talk. Then I will go into the reason for the origin of scientific research in yoga. And then I will discuss a few pioneering scientific experiments. I will just be telling you about the results because we don't have time to go deeply into the experiments per se. And then we'll try to tie it all together, whatever are there in the previous slides, to why is it important to conduct research in yoga for therapy, and how is it relevant to healthcare and educational settings. So this is the first point that we'll be looking at right now, yoga and yogis in colonial India. And I have some pictures for you, and if possible, I would like you all to contribute and tell me what is your perception of these two images. These are very old images. One is from Banaras in the early 1900s, the one with the Kamandalu. And the hint is we are talking about pictures of yogis in colonial India. So what would be your thoughts on these pictures? Anybody could unmute themselves and maybe share a little bit.
Well, they think that yogis are mad.
True, very, very true.
They were the real researchers, true researchers.
Yes, somebody spoke that.
Deepti.
Yeah, okay. Nice to see you, Dikti. Yeah.
Namaste, ma'am.
Yeah, so what did you say? They would be researchers, did you say?
Yes, they
Okay.
were the. They must be the real researchers, if we can say that.
Okay. That's your personal opinion, and I'm sure you have seen some of these images when we had our lectures.
Ma'am, can I say?
Yes, please.
Yeah, I think like they are looking like agoris and who renounced everything and living for self-realization or something like that. I don't actually. I'm thinking like that.
Yes, yes, sure, yes. Totally renounced everything and, living on the fringes of society. And how would a Britisher perceive, these people? Would anybody of you like to imagine how would British officials or British officers or just Britishers perceive such people?
Must be crazy.
Okay, okay. So all of you are right. And I'll go on and share a few more thoughts about that. So some more pictures again of these yogis who have actually renounced everything. You will see that they are minimally clad, and they are not really in the mainstream of society. They don't look like normal people. There's a lot of ash smeared. Their hair has grown, not washed. So you can imagine what a British official in the 1800s, when the British was ruling India, what they would have thought. So a British official says there are not anywhere worse characters than these jogis, they would call them jogis, or greater pests to society, save the regular thugs. So this was their impression, that they are actually thieves and also pests to society. So bad was the impression of these people, how the British perceived them. Of course, in our culture, they were not perceived in this way. We had a different outlook towards them, but for a Britisher, we can imagine. Some more pictures there, and part of it is from Swamiji's, collected work. Some of it is there in his biography. Some of it is from some collected works. So there is this Mr. Chingle who says, India's age-old yoga was veiled and shrouded in mystery, and at the same time, it was overlaid by numerous crusts of blind beliefs and irrelevant superstitions. So you'll see there, so this is again the picture of yogis. One is a very small yogi, and others are just two of them sitting together. One is smoking some substance. The other is sitting on a bed of pointed spikes. Again, living on the fringes of society. So what they did, how they lived, nobody really knew. So in one word, yoga, because the practices of yoga were restricted with these people who practiced and who also knew the secrets of yoga. It was unscientific. Yoga was unscientific, especially to the British mind. Hence, it had scant appeal to the modern mind. And also we would remember that modern Indians growing up during the British rule were also getting recruited in their bureaucracy. So they were apparently the modern Indian mind who were elite, you can say. And this is by a recent author, Lalita Kaplish. Again, some of the same type of pictures you will see. In the subcontinent, that is in India, he, that is the yogi, became a symbol of backwardness and suspicion from which a generation of modern Indians growing up under colonial rule were keen to dissociate themselves. So because yoga was getting associated with these people, people wanted to kind of dissociate themselves from yoga. And now we will look at the reasons behind why somebody thought that it is necessary to bring science into yoga, and it is necessary to do some activity, which we would call scientific research later, in yoga. So this is our founder, Swami Kuvalayananda. So he was born in 1883 and he lived until 1966. India had already attained 7. So he was very active with the Indian freedom struggle also. And sometime around the 1910s, before 1920s, you can say, he started a lot of activity related to bringing science in yoga, because when he got associated with his guru, Swami Madhavdas Ji, because of his scientific education, he was a BSc graduate. So after getting to know the practices, he felt that there is some science in yoga which I have to discover, which I have to share with the world. And he was constantly contemplating, how can I do that? So he realized, Swami Kuvalayananda, he realized fully that yoga's scientific presentation was indispensable to put it in its right perspective for the benefit not only of India, but of the world at large. And that is why we would see that when he started publishing some of his scientific research, many people came to him because now they saw something that they could relate to. So no wonder men with modern education were attracted to him, more from outside of India, but also from India. So at that time, like in the earlier slides, we saw that yoga was shrouded, and because of the yogis, it was shrouded in mystery and superstition. So Swami Kuvalayananda wanted to make it very clear to people what is yoga and what is not yoga. So this he has made it very clear. In this slide, he has talked about what is not yoga. So he says, you have perhaps seen people sleeping on a bed of shaped pointed spikes like we saw in all the earlier pictures, or witness demonstrations where individuals drink strong acids, chew pieces of glass, eat nails, devour serpents, that is snakes, eating them, or get themselves buried underground. We used to call that Bhugarbha Samadhi. We are told that all this is the art and science of yoga. And he says, I should like to tell you that none of these feats constitutes yoga. It was very important for him to make this statement because at that time, because of how yoga was at that time, restricted to these people who had their own way of living, all these stunts and feats were performed, and probably in some way, people used to get enamored and they used to think that these are the yogis. So then what is yoga? So then he says, Swamiji, I should say that yoga is that art and science which is calculated to ensure for the individual three things: perfect health for the body, infinite happiness for the mind, and perfect spiritual development for the soul. So he was very clear that if these practices are able to build these aspects into your life, then you have yoga in your life. And that is the art and science of yoga. Thus, yoga is a science which leads to physical, mental, and spiritual perfection and is based upon principles that are thoroughly rational, scientific, because science comes from rationalism, logic. So these two things about what is not yoga and what is yoga. And so he established, because he wanted to really share the science in yoga with the world. And he also admitted that it is not just a science, it's also an art, because you have to perfect that art. There is so much of dedication which is needed. And of course, you have to think rationally and logically, which is the scientific part. So he established Kaivalyadhama formally, because Kaivalyadhama got established by, say, 1917 is what the records say. But formally, with all the registration and all that, it was established in 1924. He also established the scientific research department at that time. This is a picture maybe around 10 years ago. the scientific research department still looks the same. But probably did not look this way when he established it. And I will come to that in a little bit, but because he had started doing so many experiments, when he started or formally established Kaivalyadhama and the scientific research department, he also could release or launch the first yoga journal, yoga research journal in the world in 1924 itself, in October. So October is also our foundation day, and that is when all these things, were launched. So now let's come to some of the, scientific experiments which are pioneering in their own way in yoga. So I'm going to present to you the most famous experiment. This is actually the third experiment that he conducted, but this became the most famous. So what happened was, and why this became so famous, that we'll get to know. So at that time, because like I spoke, there was so much of, misinformation about yoga, and science had not even started in yoga at that time. So there was a Dr. Bell from the US in the 1920s. He proposed about this practice called Noli, which I'm sure all of you all know about. I'll show you some pictures also. He proposed that this Shuddhi Kriya, or cleansing practice of Noli, what it actually does is it creates anti-peristalsis. So it's called the anti-peristalsis hypothesis. So just to understand a little bit about peristalsis and anti-peristalsis, I'll show you some pictures of Noli for your understanding. So peristalsis is something which is the natural movement of food inside our intestines. So how does it go? So the action is shown here, but in order to give you a more intuitive picture, I would show it like how the earthworm would move. It would contract itself, relax, and then move forward. Contract itself, relax, and move forward. So, a wavy motion which moves things forward, and that's the food part, the bolus of food. It's moving forward, and that's how the food is moving forward. So this is peristalsis. This is natural. Now, anti-peristalsis is the opposite of this, which means that instead of the food moving forward very naturally and slowly, there is some kind of a backward movement of the food, like what would happen in regurgitation. And so the food is not thrown forward, but it's thrown backward in a very unnatural manner. So Dr. Bell was proposing that while doing Noli at the place of the rectum, what happens is the anti-peristaltic movement. And yeah, before showing this, let me show you Noli. So these are images 1, 2, 3, and 4. The first two images, I'll explain a little bit. So the first image is actually Uddiyan Bandha. And Swamiji's experiments, the first two experiments which he did was actually on Uddiyan, but not so with X-ray experiments. He was just trying to know what really happens when somebody does Uddiyan. So the first image is Uddiyan, and after doing Uddiyan, you lead yourself into doing Noli. This is the famous Noli, which is called the Madhyama Noli or the middle Noli, the second picture. And then the third and the fourth picture is the right and the left Noli. So it is called Noli Chalana, or rotating the Noli. So this is the rectus abdominis muscle, which is rotated. It's called Noli Chalana. So the precise image of Noli is the second picture, and that's the Madhyama Noli. The first is Uddiyan. So from Uddiyan, you go into Noli, and then you go into Noli Chalana, which are the third and the fourth images. So Swamiji was very upset when he heard about this anti-peristalsis hypothesis, which was proposed by Dr. Bell. And we see his comments also in the first issue of Yoga Mimamsa that, people are making claims without really testing anything, and they are making some hypothesis. They don't even care to test it. At least they should find some way to test it if they are making a hypothesis. But for him, why did it upset him so much? Because these are his words in the Yoga Mimamsa. The hypothesis, that is the anti-peristalsis hypothesis as it stood, had a highly dangerous import for yoga. The anti-peristaltic action is unnatural in the rectum. If it develops there, it leads to serious constipation and to the consequent state of auto-intoxication. So, and you would see that, these kind of things were major motivators for all his scientific experiments. He basically wanted to bring the real science in yoga to the world. So he said that now I have to do something about it. He took to the laboratory. He was already conducting experiments on Uddiyan, so he now chose to experiment with Nolly. So with a siphon barometer and a rubber tube attached to the one end of the siphon barometer, it was passed into the rectum of a subject, and the pressure was noted. The pressure change was noted. What he found by doing this experiment was that Nolly creates a negative pressure in the colon, that is the large intestine, and not anti-peristalsis. So he explains in Yoga Mimamsa, so the action is more like the water pump. Air gets sucked into it, there's a vacuum created, and then water will get sucked into it. So that's what he had in mind, but he had to test it. Otherwise, he would be like Dr. Bell only, just giving a hypothesis without really conducting any scientific investigations on it. So when he saw this and he repeated these experiments also on different subjects, this faulty hypothesis, anti-peristalsis hypothesis, was dispelled. And that is why he wanted to publish it right away when he established Kaivalyadhama. So I told you that Swami Madhavdas ji from Malsar in Gujarat was his guru. And Swami Madhavdas ji, I'll show you his picture. He lived a good 123 years. And all his training in yoga and the spirituality in yoga came from Swami Madhavdas ji. Of course, the scientific aspect also came, but Swami Kuvalayananda applied his own mind to it. And of course, he received the support of his guru. So in reverence of Swami Madhavdas ji, this experimental finding, which would go out into the world, and people would get very interested in the science of yoga, he named it Madhavdasa vacuum. Okay. So what was so great about this experiment? So during that time, that is in the early 1900s, 1920s, water suction voluntarily into the colon and bladder by yogis was attributed to miraculous powers, just like they would eat glass or they would eat serpents or whatever. So this was, in some small way, people used to think that, okay, he is a yogi, he has miraculous powers, and this is a siddhi, sucking water into the colon. And they usually this is a cleansing practice, we have to remember. So the way these yogis would do it is they would go early in the morning in the pond in hip deep water, and they would do nolli. So the water in the pond would get sucked into the colon from the rectum, the anus, very automatically. So the procedure was they would do Uddiyan, then nolli. And when they do nolli, that negative pressure or the vacuum, Madhavdasa vacuum that Swamiji is talking about would get created, water would get sucked into the colon, and then they would do nolli chalana, due to which It's like, cleaning a bottle. You'll just shake it like this and you'll clean the bottle. So they, with the help of this cleansing practice of Noli and Noli Chalana, they were cleansing their colon. It's a Shuddhi Kriya. So experiments on Uddiyana and Noli practices of Hatha Yoga threw light on the physiological changes. So yoga and physiology was totally disconnected. There was no link at all between there is a physiology in you. So when these type of physiological changes in terms of the negative pressure, the negative vacuum, so it threw these experiments threw light on the physiological changes and explained the so-called miraculous principle of water suction into the colon. So these experiments served two purposes. It busted popular misconceptions, especially what Swamiji wanted, that the unnatural type of anti-peristaltic action, which was hypothesized, that got cleared. And the exact physical and physiological mechanism of these practices was unraveled for common people through articles in Yoga Mimamsa. And so this is a picture from Yoga Mimamsa. I think this is Swami Kuvalayananda himself doing this practice, is what people tell me. So like I said, the rectus abdominis rolled to the left and to the right. So before these experiments by Kuvalayananda, the possibility of creating such pressure changes in the internal cavities by voluntary manipulations was not known to modern science, nor were the Hatha Yoga practices being investigated whatsoever in the field of physiology. So this is where the science sort of came into yoga, and people started noticing that. So it was important to share this knowledge with the world. It was important to educate people about the research that he had already started in 1917. So he thought that the best way to do this was to start a research journal, which he named it as Yoga Mimamsa. The first issue is of October 1924. There's a picture of you of the first issue. And this is how it looks right now, Yoga Mimamsa. It is now an online cum print journal. Earlier, it was only a print journal. We published biannually right now. And Swamiji published, he published it quarterly. So I would say that, so when we are talking about, so the earlier experiments that he did, it was therapy based. So when we are talking, and I'll come to that when I try to tie everything together, but just to give you a very sneak preview here of when we talk about the theme of our FDP, that therapy, he did some experiment to understand the therapeutic value of that practice. But education is also important. Just doing that experiment and getting his doubt cleared was not what he wanted. He wanted to share that knowledge with everybody so that when people talk about yoga, they think about it scientifically. So now I'll be sharing a few more experiments. Like I said, it will not be possible to really present the whole experiment. Here, I'll just share a few, interesting findings from his experiments here. So this is the fourth issue the fourth volume of Yoga Mimamsa, and the first issue, which was published in 1930. And he did a lot of experiments in pranayama. After doing on the Shuddhi Kriya, his next target was trying to understand pranayama in depth. And even before understanding pranayama, he tried to look at normal breathing. And even that, he tried to not just breathing, what happens when you inhale, what happens when you exhale, and then how much oxygen is getting into your lungs when you inhale, how much CO2 is getting exhaled when you exhale in deep breathing. So even before approaching pranayama, he wanted to know the basics of breathing, inhalation, exhalation, and what is happening. So he was very interested in researching the pranayamic physiology. So he knew that there is a lot of the physiological mechanism which we can tap related to the yoga practices. So these are some, interesting comments that he's making in Yoga Mimamsa. There hasn't been any research as such, but because of his related to this, what I'll be talking about, the next 2 points, but because of his research on pranayam, he was able to make these suggestions. Swami Kuvalayananda believed that serious mistakes are likely to be made in prescribing pranayam for cultural or curative purposes if the pressure changes within the chest, lungs, and abdomen while performing this practice are not sufficiently known. And that is why he wanted more research to be done. He remarked that pranayam must be practiced only after adolescence. So he's saying, say, after 13 years, teenage. And if prescribed to boys of younger age through ignorance, is likely to do harm to the juvenile heart. And he explains a little bit of the mechanism why he's suggesting this, because he thinks that the heart is not yet well developed in children. Only when they reach adolescence that will happen, and they can take the pressure changes which happen in pranayam, which when he researched, he found that those were immense pressure changes which were happening in our chest, lungs, abdominal area, which he said intrathoracic, intrapulmonic, intra-abdominal, and also intraesophageal pressure. Also, he says that any yogic treatment of a weak heart, and he's referring specifically to pranayam, if it is to be safe, must be based upon a knowledge of pranayamic pressure changes. Otherwise, it may do more harm than good to the patient. And like I said, this was all because of the experiments that he was already conducting. And yeah, this is a very interesting experiment here. And there weren't the best of facilities at that time at Kaivalyadhama. So he was very ingenious in the way he invented or he formulated his experiments. So with that ingenuity, he found that when he was doing these pressure experiments in pranayam, he found that inhalation done with a controlled abdomen, and I'll show you some pictures what it means, as is practiced in pranayam, because he's very clear there. He says that in pranayam, you should be practicing with a controlled abdomen, and that is supposed to be the practice. So inhalation done with controlled abdomen rather than with a contracted or a protracted abdomen produced greater pressure changes while doing pranayam, which he says favored greater blood flow into the heart as well as an inhalation of larger quantities of oxygen. So this is the picture again from Yoga Mimamsa, again 4th volume, 1st issue. So the first picture is that of deep inhalation with controlled abdomen. And this is the side view. So you can see the abdominal position. And you can compare it with what he says as the contracted abdomen, when you are taking the abdomen fully in, or the protracted abdomen wherein you are actually taking in the air and the abdomen is getting bloated. So nowadays we have so much of this thing that, sectional breathing, abdominal breathing, but this is very interesting that Swamiji, when he was doing these experiments, in whatever small way he was doing, but he was trying to approach it in a very rational manner. And with these experiments, he did some 12 experiments step by step. And this was the result of a few of his middle experiments, wherein he says that you inhale and you release a little bit of air and you put it in the controlled position instead of keeping that air fully there in your abdomen, which is the protracted abdomen. And this was also a hypothesis which was proposed by somebody in the West, And he is criticizing people in the West by saying that, again, they are saying this without doing any scientific experiments. So I want to see if what they're saying is true. And he found that with contracted and protracted abdomen, the pressure change is lesser. More pressure change is happening with the controlled abdomen, which is why there is greater blood flow and more opportunity for the oxygen to go into each and every cell of the body. I don't think anybody has repeated this experiment. It is, until this date, it remains, unrepeated, if I may say. And another interesting thing which I thought I would present to you is his very interesting statement on pranayama. And again, he has done experiments on this, but not specifically on nerve culture, but on pressure changes in pranayama, due to which he has made this statement. So value of pranayama for nerve culture, Swamiji was of the opinion that this was his personal opinion, but he has tried to kind of explain it also, that the value of pranayama, according to him, was more in terms of nerve culture. What is nerve culture? We'll try to look at it a little bit, because there is no experiment per se on only this nerve culture. But he has done experiments with O2 absorption and CO2 elimination, sorry, that is oxygen absorption and carbon dioxide elimination. And after doing these experiments, he thought that, and there are some very controversial also, if I may say, because he said that there is not really much value of kumbhaka in the pranayam. Even if you do a normal pranayam with puraka and rechaka, that should be fine. Proportionately, what the benefit you should get, you're not really getting in kumbhaka. But yes, I'll leave that for now. But coming to nerve culture, because this is a very interesting point he wants to make. He's not saying that oxygen absorption and CO2 elimination are not important. He's just saying that when you look at pranayam as a holistic practice, when we are just restricting it to oxygen absorption or carbon dioxide elimination, we are reducing it to a bare minimum, the benefit of the practice. It's so much more. So he says, these are all quotes from Yoga Mimamsa, and he has written them. The combined action of the diaphragm and the abdominal muscles pull up the lower part of the spinal column. Because there's so much of, when pranayam, when you're doing it properly, there's so much of pressure change happening inside your body. So the way you're moving your diaphragm, your abdomen, your chest, and how the lungs are getting affected, there's a lot of pressure changes happening. And he also says that, because you're sitting in an erect posture and all that, so muscles are getting pulled up, and also the lower part of the spinal column. If Jalandhar Bandha is practiced, which is very common to have, at least this bandha is usually practiced in, that is the jugular knock, wherein you just lock your chin to and place it on the jugular lock, is practiced. The upper part of the spinal column is also pulled up, because there is that stretch, right? You're moving your head down. This pulling up of the vertebral column as a whole gives exercise to the sympathetic system and the roots of the spinal nerves, the whole of the bunch of the nerves which exist in the spinal column. Due to the alternate rise and fall of the diaphragm and the alternate contraction and relaxation of the abdominal muscles, that is accentuated, that is heightened in pranayam, all the organs, starting with the bowels, kidneys, and lungs, and thereby the others, get well massaged and toned. They keep functioning smoothly. So when we are talking about nerve culture, it's not just about our nervous system. It is not just about our brain or, just the nervous system. because of so many things happening when we are doing pranayama, other organs are also getting affected in a very nice way. The massage and the toning that is happening because of the pressure changes, it helps them to keep functioning smoothly. The nerves and muscles, once toned up, continue to maintain that tone for a considerably long time, even after doing pranayama. So, in general, this is what he had to say about pranayama. It helps the nervous system to pass the nerve impulses efficiently, helps the endocrine system to support the nervous system, as well as the circulatory, respiratory, digestive, and excretory systems to function in a way that blood rich in oxygen and nutrients is supplied to every tissue of the body, and there is proper elimination of waste products from the body. Nowadays, you will see that there is a lot of research and interest on gut microbiome. And even if you meet like the real yoga practitioners and the experts in yoga, they will say that gut health is very important and constipation is very bad. That's one thing that you should avoid. So, even in those ways, our body is getting so much trained. It's not that through pranayama, nerve culture is happening is what Swamiji is saying, but he saw it as a very broad mechanism. Of course, that has not been explored in any of the studies, either which he did or even afterwards. The intrathoracic, intrapulmonic, just a moment, please. The intrathoracic, intrapulmonic, and intra-abdominal pressures also undergo considerable changes in pranayama. All these three types of pressures are rendered extremely high during pranayama, practiced with the three bandha of Mula Bandha, Uddiyana Bandha, and Jalandhar Bandha. So, if you're doing pranayama for awakening your kundalini, so pranayama is practiced with the help of these three bandha. So if you're doing these three bandha, Swamiji says that the pressures are rendered extremely high. Already the pressure changes are happening in pranayama to a great extent, and it's rendered extremely high. This high pressure gives peripheral stimulus to the different nerve plexuses situated in the abdomen and the thorax, in turn to the whole nervous system. So I have a few minutes left wherein I want to tie up everything. So these are some of the findings and his statements which he out of the experiments that he did that I wanted to present in front of you. We don't really have much time to go into the other experiments. So let me just now tie things together here. So what is the importance of research for yoga as therapy in healthcare and educational settings? So I would say that, each aspect of these three entities are feeding into each other. So say, let's start with yoga therapy. So when in a healthcare setting, you are offering therapy to the patient. But how do you know that the practice that you're offering is the best practice for that person? So you need more research. And it's very easy in a healthcare setting to, if not go for bigger type of researches, at least do case study research. And sometimes this is very, important, and sometimes this can also be something which will really help so many other yoga practitioners and yoga therapists. If that one case study, which is a little unusual, is reported, say, for example, a person with fibromyalgia, that person is able to do Om chanting very well, but if you ask that person to do Bhramari pranayama, that person gets a splitting headache. Why? So these are things which crop up in the, these kind of situations, case studies will crop up in the healthcare setting. So when documentation is done properly and the case is followed up with a research attitude in mind, then it contributes again more to the therapy. So it's a feedback loop. Let's take yoga education. How can you give proper yoga education to people in an educational setting without really knowing and being confident that what you are teaching them, what you are imparting, the education that you're imparting to them is really correct? And research is an iterative process. It never stops. You always, you want to go back and see, okay, if you have got the results, can we repeat it and can we get the results? If you've not got the results, what went wrong? So again, yoga education, for yoga education, yoga research is very important. And so whatever research you are doing, it feeds back into the education system also. And when you give that sort of, when you create that sort of interest through yoga education in people, there'll be more researchers coming in who will be interested to do yoga research. So this is something which is, it is just feeding into each other. It is a feedback loop. And when you take the case of yoga therapy and yoga education, when we try to impart yoga education to students, we take them to the healthcare setup. We tell them what is being practiced. And in yoga therapy also, yoga education, if you have skilled people who have learned yoga very well, who have been educated in yoga very well, will again contribute to the efficiency of yoga therapy. So this is an entire feedback loop. Your research cannot exist in isolation. If yoga therapy and yoga education have to improve in those respective settings, yoga research will have to come into each of these settings, and they have to talk to each other. The crosstalk is very important. And yeah, probably we can leave 5 minutes for question and answers. I just have this one last slide by Swami Ji to present to you. This is what I found in his book on yogic therapy, on how important he considered research for yoga therapy. He had coined the term yogic therapy. Of course, now it is yoga therapy. Neither is it enough for us to dote upon the methods, that is of yoga, just because they were handed down to us by our forefathers, nor because nor that they belong to a class of holy men who must have only the good of the people at heart. So he's saying just this awe is not the only thing that has to be there in yoga, and that's not the only thing that we should focus on. Mere good wishes on the part of its protagonists or our national and racial sentiments for the therapy, that is the yoga therapy, should not lead us to have blind faith in it. So from the very beginning, in all of his Yoga Mimamsa issues, you will see that he has said that nothing that has been properly and scientifically verified will be published in the pages of Yoga Mimamsa. Only when it has been scientifically verified, or only when we can offer a proper rationale or a hypothesis based on our experiments, will it be published in Yoga Mimamsa. And there is the famous quote from Swami Kuvalayanandaji also, that yoga should not be diluted. So he says it should be a duty to verify its results, that is the results of yoga research, and to explore the exact psychophysiological mechanism of the channels through which these results are obtained. So with that, I thank you so much for all of you for being there and for sharing this knowledge with me. Thanks a lot.
Thank you so much, Dr. Praseeda. That was a very elaborate presentation that highlighted the path-making efforts of Swami Kuvalayananda. And I found it very interesting because just on Sunday, in our pranayama course, we were discussing these pressure changes with the bandhas. So it was interesting to actually see what Swami Kuvalayananda had said. because I was referring to the Yoga Mimamsa work he had done and the importance of the bandhas. There was a similar work done in the 1970s by Swamiji at Jimma, published in Yoga Life. And it was, again, very, very important path-making works. And the way you led us from the mysticism of yoga as it was seen to a scientific, rational perspective to the work of Kaivalyadhama is the very reason we wanted you to give this talk during this FDP. So your talk has satisfied the need that was there. Thank you so much for your exposition. If there are any questions, we can go to them. There's a question from Niyanta Joshi. Controlled abdomen gives massage more than contracted abdomen. She's asking a question if you'd like to.
Yes, that was Swamiji's finding. So what I showed you, the three images of the contracted abdomen, wherein, you know, it's like a C, a total C, and the protracted abdomen where there is a bulge. So he made the subjects do the pranayam with the contracted abdomen as well as the protracted abdomen, as well as the controlled abdomen. And what he found was the pressure change in the controlled abdomen was greater than these two other abdominal postures. So yes, controlled abdomen, it gives more. Because why more massage? Why? Because the pressure change is greater. So this is an implication. He has not said more massage, but he has said greater pressure change.
I think that's a very good clarity. Is the pressure changes we are talking about, not a massage.
Okay.
And I think, you know, again, technical terms and layperson terms have to be understood in some of these contexts. But it's a nice one. Thank you for answering that. Anybody who wishes, we have a few more minutes that we could do. And Ananya is asking, can we give Nauli Kriya as suggested by Swamiji?
So Ananya, if you could just elaborate on that question, like in what context are you asking that? Give Nauli Kriya is not very clear to me. So either if you could type or maybe you could unmute and ask your question, that will give me a better picture of what exactly is in your mind.
Good morning, ma'am. Like you suggested that Swamiji was angry when you were trying to tell no, like Nauli Kriya is suggested, right?
I couldn't hear you that well. I just heard the last bit. Nauli Kriya is suggested. Yeah. For what? In what context? Could you please throw light on that?
In that context, you said no. Before you said no, like you have abdominal breathing and sexual breathing. In that you said about Nauli Kriya.
Okay. Okay. I have not understood your question, Ananya, but very quickly, let me try to just explain what I was trying to say. So there was this anti-peristaltic hypothesis which was proposed by a Westerner, and Swamiji thought that this sort of hypothesis is dangerous to have in yoga. But he wanted to have an open mind and he wanted to just test it, that what this person is saying, is this really true? Is anti-peristalsis happening? So when he did the research with an equipment, he found that it's not anti-peristalsis because the tube was inserted into the rectum. So there was a tube which was inserted into the rectum, and when the noli was being done, the water was still getting sucked. So if it was anti-peristalsis, then it would start at the rectum, not at the level of the tube. So that is why he says that this hypothesis does not have ground, and in fact it is It has dangerous import for yoga because this would cause constipation, the antiperistalsis, the antiperistaltic movement. So that is what he wanted to say. So, and I'm trying to make sense of your question. Can we give Noli Kriya? So, see, Noli is not a very easy practice. Among the 6 cleansing practices, it is one of the most advanced practices. Noli is usually done with basti, like I said, the colon cleansing, like, you shake your, you rotate with the help of Noli Chalan, and you're basically cleansing, like, you would cleanse a water bottle, like shaking like this.
Thank you, ma'am.
Yes.
I think our Indian has a question. Yes, Indian, you can unmute. Please.
Yes, thank you for a very nice talk, very enlightening. It was very interesting to hear about how this Kuvalayananda, the great pioneer of yoga research, had such clear thoughts about the necessity to do research, to get away from this mysticism that was surrounding yoga in early days, and also how he also wanted to use his research to enlighten people. So not only research, but this popularization or dissemination of research. So and especially this his insights that how pranayama impacted the whole nerve culture, not only absorption of oxygen and elimination of carbon dioxide. So I was just curious, how would you say that this pioneering research has that, what has that inspired in your institution, the Kaivalyadhama? Are you still continuing that kind of research?
Okay, thank you so much, Dr. Ingun, for that question. And thanks a lot for, all the feedback also. So I would say that Swamiji's approach towards scientific research in yoga and also philosophical literary research in yoga, that has been upheld. But yes, I would say that there is more needed, because what is happening is Swamiji basically wanted to see if we can tackle the spiritual dimension of yoga through research. Now, we have not reached that far. And his emphasis was more on fundamental research, due to which you see all these experiments in the first 7 volumes that are published. But slowly what has happened is we have moved more to applied research. So I wouldn't say that fundamental research is not happening, but it is tied with applied research. So, so both are going hand in hand. But yes, if we want to really achieve Swami Kuvalayananda's vision, then we have to do more basic research, so that at some point in time, Kaivalyadhama can actually tackle the spiritual dimension of yoga. That is my personal take on it. There is always a more, more to do. And yes, I also feel that in general, in the yoga field, a lot of importance is given now to therapeutic research, research in yoga education, and applied research, basically either on healthy people or on certain, conditions, diseased conditions. The basic research is missing, which we as a yoga community will have to kind of, revisit our focus and try to see how we can give impetus to that as well. Thank you.
Thank you.
I would suggest that since we have already used up our time, if there are any questions, please put it in the chat. I will try to answer them. Thank you.
Thank you so much, Dr. Praseeda. And as always, very timely, very to the point, and fulfilling the felt need behind bringing you into the FDP. So congratulations. Such a pleasure to always listen to you and have your inputs. And again, this type of activity furthers the MOU that Kaivalyadhama and SBV have. And I know that tomorrow you are planning some more activity with children with special needs, where Meena will be coordinating with you on that. And end of the year, I know you have some plans. So looking forward to all of that. And at this point, I will go back to Dayanidhi to introduce the next speaker, which will be Dr. Meena Ramanathan.
Thank you, sir. Yeah, just share the slide. So our next speaker for today is our Professor Dr. Meena Ramanathan, ma'am. She is the Vice Principal of School of Yoga Therapy of ISCM, SBV, a student of Rishiculture Ashtanga Yoga Parambara, PhD guide, recognized IAYT certified yoga therapist, and a joint secretary IYA Pondicherry chapter, and a lead examiner for YZB Yoga Certification Board, Ministry of Ayush. She is a subject matter expert and task force member for CSYR and Traditional Knowledge Digital Library Project, Government of India, and journal coordinator for Journal of Applied Yoga Sciences at Loyola Marymount University, USA. She is a member of Para Yogasana Sports Promotion Committee of NYSF, and she has 79 scientific papers, 26 abstracts, 6 chapters in book, and 10 copyrights and 15 compilation of her credits. An area of special interest, Divyanka Yoga, Silver Citizen, and for transgender population. And she is recently awarded with the Lifetime Achievement Award by Dr. B. Ramaswamy, and officer of the Standing Hearing Applicate Committee, AICTE, Government of India, and a member Asadika Amit Mahotsav Committee. And she also received a Major Dhyan Chand Award for Best Star Coach by the Pondicherry Yogasana Association. And now I welcome Meena Ramanathan, ma'am. Yeah.
While we are shifting the mic from Dayanidhi to Meena, she is presenting from that same computer. I would like to also just express that what Dr. Meena is going to be presenting today is a highlight of research work done here at Sri Balaji Vidyapeeth over the past decade plus. So, you have a day of research presentations today of different types. And we wanted that you get an idea of the type of work being done here, which is being published as a monograph and to be released on Yoga Day this year, where we are releasing 76 studies from SBV that are there in yoga therapy and music therapy. Today, of course, the focus is yoga therapy because the FDP is yoga therapy. So welcoming you once again, Dr. Meena, over to you and wishing you the best.
Thank you very much. I hope the screen is visible. Without much ado, I'm just going straight in without losing any time. With due respects to the Guru spirits. Om Shri Gurubhyo Namaha, Harihi Om. Thanks and gratitude to my Guru, Professor Dr. Yogi sir, for whatever I'm doing, whatever I am. It is all credits to him. And Swami Kuvalayanandaji also, because that was a wonderful presentation by Dr. Praseeda, such a crystal clear presentation as to what was the main purpose with which Swamiji started this whole, research, what basic research is and what applied research is, and where we should move ahead from now. So thank you, Praseeda, for that. And so as short background, I think sir has already filled you in with this. What used to be the Center for Yoga Therapy Education and Research, CYTER, earlier in 2010, now has been upgraded into the School of Yoga Therapy under the Institute of Salutogenesis and Complementary Medicine. And healthcare setting is something, you know, which is very, very, we are very fortunate to have this opportunity to be in this setting, where we have the opportunity to be in a hospital with the medical doctors, and, you know, like both the medicine as well as the traditional aspect of yoga coming together, getting bridged here, and investigating the role of yoga therapy as an adjuvant along with the modern medical care is what we are trying to do here, both qualitatively as well as quantitatively, to promote, you know, to establish yoga as a preventive, promotive, rehabilitative, as well as a curative therapy. So this is something, a suspense actually, because we are going to be releasing this booklet for the Yoga Day this year. We have 2 more booklets also. So this is part of it, where it is a compilation of the abstracts of all the research work done by the ISCM team from 2010 to 2022, bridging traditional healing systems and modern medicine, medical science through salutogenesis. So this contains 76 abstracts to mark the 76 years of the Indian independence. And we celebrate the power of yoga therapy to transform lives and promote healing. At least that is our attempt. So what is research? To keep searching again, from the word research, to go about seeking. So what are we seeking? It is not just something external, but in yoga, it is like we go inward and seek what is to be sought. That is, you know, to add up to the knowledge, to test it, to measure data, all those being part of what it is all about. And what is yoga therapy? It is not just exercise. It incorporates a combination of all these, you know, yogic counseling, diet, lifestyle modification, the breath body work, relaxation, meditation, chanting, mindfulness, and more. And why are we doing all this, integrating all this together? So that the inherent healing mechanisms can be facilitated to work at its best, and for empowering the individual to be their best always. So yoga therapy is now a household name, and it is not something new. And it has become so popular nowadays that medical doctors now are really supporting us very much. You know, initially we faced a little bit of resistance from them as to what we are trying to do here. You know, a traditional science and art of yoga, what are we trying to do in a medical setup like this? But now they know that we are doing something as an adjunct, as a complementary therapy, and we are not claiming to be alternative therapy. So then now we have, you know, like we have earned more support from all of them. Medical journals reveal research highlighting yoga's multi-tiered benefits nowadays, you know, like highlighting on all this. So in this technological era, the healthcare is now transitioning from a narrow-minded, short-sighted, myopic focus on just the treatment for a disease to a broader approach where, you know, we try to promote overall holistic wellness. And that is what this whole journey is all about. To approach what is the root cause of the disease, can we try to address that, can we alleviate that? Along with the medicine and yoga, can we promote that holistic wellness for the seeker, for the care seeker? So different topics on which we have done the research with different, you know, collaborating with different departments of this hospital, going through all that very quickly. Role of yoga therapy, promoting salutogenesis. So here, all the SBV staff, faculty, the administrative staff, management staff, the students of the medical, dental, all the streams, all the institutions here, all of them, get exposed to yoga therapy. And the salutogenic component here is being practically implemented. So what is salutogenesis? That we try to enhance the sense of coherence. Sense of coherence meaning the comprehensibility. Do you understand what is going through? Can you see what is your problem? Can you understand that? And then, can you manage? Are you able to manage everything on your own? Do you manage things well? And what is your meaning in the whole thing? Can you find the purpose? And all these, in addition to the coping skills that can be developed, we have a positive, finding through all these studies that we have done, where we have tried to implement all this and see if the coping skills in these SBV people has been enhanced. So they have been the volunteers in studies, major studies, that I'll be listing below. All these are the studies. I'm just going through the titles now here. Any day, anybody wants it, we are more than happy. As our director, Anda sir, he believes in sharing as caring, and we don't hold anything tight just to ourselves. So anything you want, please feel free to check with us. We'll share it immediately. So these are a few of the publications, because we have selected only 76 of the abstracts, and I have limited this presentation to those 76 abstracts. So what are the findings from all these studies? If evidence of the techniques that we have tried, in these studies, yogic techniques, some being with Surya Nadi Pranayama, some with Chandra Nadi Pranayama, Surya Bedana, Chandra Bedana. There have been a permutation combination of various techniques that have been applied. And overall, what are the findings of all these studies on salutogenesis? So we found evidence of sympathomimetic effects of right nostril initiated pranayama like the Surya Nadi, and sympatholytic or parasympathomimetic effect following the left nostril. So this is also in tune with the original traditional Swara Yoga concept, where we come to understand that Pingala Swara, or the right nostril initiated, is activatory in nature, and the left nostril initiated, the Ida Swara, is relaxatory in nature. So with all these studies that we have done using these techniques, that has been re-established now. And we have found that there is a balance that is attained with the sympathetic and the parasympathetic. So normalizing these two, where we are trying to achieve the autonomic balance. So modulation of the autonomic tone is also achieved. And we found that breathing in increases the heart rate, and expiration, breathing out, decreases it from the studies. And we also found that Surya Namaskar as a practice is enhancing the neuromuscular abilities of the practitioner, so which can be applied to those who need it actually. So that is the main purpose with which we are doing, so that we can establish that this could be applied into a population that are needy. And the main effect of the uninostril pranayamas or alternative nostril breathing pranayama, the effect is that of the initiating nostril rather than the nostril used for expiration. Say, for example, we are doing Anulom Vilom, wherein the initiation is through the right nostril. So that effect is found. When we found, when we were trying to compile the analyze the data that we got. And we also found that supine relaxation is more pronounced after performance of asanas as compared to relaxation just given plain, which again, implies that effort preceding relaxation has a better response. Like we say, spanda, nishpanda. So the relaxation is more pronounced if it is followed after activation. And conscious relaxation promotes the healing environment in the individual and it also normalizes the imbalance of the autonomic nervous system. And understanding these, like I said, can be, we can try to appropriately apply this wherever required. And improvement in the quality of life indices from a questionnaire that we applied in the student population. You know, it had the family status, health status, economic status, social status, and all these dimensions were measured, which correlated all, there was an enhancement after yoga, which correlated very well with the attendance. So the more classes they attended, the better the benefit. So this made our, management and administration of SBV to include yoga to all the students of SBV. So now yoga is part of a curricular or co-curricular or an elective activity for all the students here, which, like I could say, like the applicatory aspect is now, again, SBV has done it, proved it yet again. And pranayama practice, we found with the students, is more introspectional and asana is more externalized. So pranayama enhances the learning capabilities among students. And we also found that as a technique, pranayama, wherein we have these three nada combined together, the pranava japa, pranava pranayama, is an effective technique in enhancing the oxygen saturation levels. So this was a study which we did during the COVID, and we found really beneficial effects wherein the oxygen levels came up with pranava pranayama. Only one technique, nothing else was done. And with the pranava, the nitric oxide levels we found were increasing due to, the endogenous nitric oxide production, which is enhanced with the Makara Nada and with the Valsalva effect. What is the benefit because of that? It is vasodilatation. There's a study earlier done that with, nitric oxide being 15 times, produced 15 times more than the normal breathing with the Makara, with that. So like in Bhramari Pranayama also we find the same benefit. So here we did it and we established that, nitric oxide, which produces vasodilatation, which means relaxation, and the BP comes down. So these were correlated with this study. And we have this as the ongoing study right now happening. Data collection is just done. And what is the role of yoga therapy in general medicine? Here we found all the non-communicable diseases, the NCDs, as we say, which are being treated at the general medicine department. There is a benefit that is happening because of yoga therapy. One is like as a preventive, and the next one is management of that disease, as well as, like we can halt the progression of the disease into further proceeding into further complicating the matters. So with yoga therapy as an intervention, these are the benefits that we have found. A few of the publications that we have done in this department with this, interacting interdisciplinary work with general medicine, a few of them. So what are the overall findings that we found? The heart rate, the blood pressure, the derived cardiovascular indices, which we derived using formula, using these three, the systolic pressure, the diastolic pressure, and the heart rate. And then we derive at a few mean pressure, pulse pressure, and all those. So we found that with a single session, there's a marked decrease in all this, like normalization again. For those which it was low, it was enhancing. So it was normalizing, and the magnitude of reduction or normalization depends on the pre-existing comorbidities and the pre-existing conditions for the individuals. And there was a significant reduction in the lipid profile, the triglycerides, the LDL, the low density lipoprotein, the very low density or the high density, which enhanced. High density is the HDL, is the good cholesterol. So it is a karma yogi, like Ananda sir keeps telling. So that has enhanced, that has come very well. And we found this in the chronic kidney disease patients, which is again a very, very beneficial finding. And we are trying to apply it also now. So you'll hear more from all this. and positive changes were attributed with the enhanced harmony. So what is now stressed is now returning back into its state of relaxation. Harmony is present because of the breath body work, the mind body relaxation, and as an adjunct, it is also cost effective, reducing the medical, the medicines that you're taking, also reducing so much of the side effects that happen with the medicine intake. So with yoga therapy, therapeutic as an adjuvant therapy, there are so many benefits that are happening. We also found beneficial effects with the glycemic control, that is the sugar levels, the blood sugar levels were coming down in diabetics, and insulin resistance was coming down. Perceived stress also is reducing, like decreasing the complications that usually happen in the type 2 diabetes patients. And again, metabolic risk factors which we saw, like dyslipidemia, which is like the lipid profile parameters, the LDL, the HDL, all of them were coming down markedly. Like the anthropometric parameters were also coming down with our study, the data collected from the metabolic patients, metabolic syndrome, patients with metabolic syndrome. So which means that they are the hip circumference, the waist circumference, the neck circumference, all these are part of the anthropometric measures, as well as, the BMI, the weight, height, and all that. And all of them coming down, which means the metabolic risk factors are also reduced. And, like this enhances the efficacy of the drugs that are being given to various conditions and various people, and reducing, again, the side effects. So these are a few of the ongoing studies, and I'm very, very happy to say that all these studies are randomized control trial, which is the golden standard nowadays in research that is happening. In pulmonology, the respiratory medicine, respiration, one of the most important. See, talking about, the systems, each and every system is important, but, in yoga, this is more pronounced, I would say, because prana is what, like everything that we are doing is depending on that energy, the prana, the vital energy. So this plays a key effect, and yoga has a very, very vital role to play as far as, the respiratory medicine, pulmonology is concerned. A few of the studies that we have done in collaboration with the pulmonology, the respiratory department, and what we found was a significant improvement in the respiratory parameters, the forced expiratory volume in the first second, vital capacity, the forced vital capacity, and improvement in all the pulmonary function test parameters, resulting in a decreased airway resistance in COPD patients, where there is a constriction of the airway happening. But we find that yoga therapy has enhanced broncho relaxing effect, so that the constriction is now relaxed, and it is really helpful in the management of COPD in patients diagnosed with such a case. And the quality of life, you just imagine you're not able to breathe properly. This is one of the basic functions which we do unconsciously. Are we focusing now on breathing? No. When do we focus? When we have a blocked nose, right? I'm not able to breathe properly. I'm finding it difficult. So that is when we consciously think about it even. So now mindfully doing all these practices, the quality of life in these people is very, very low, because the basic activity is not, we are not able to do it. You breathe in, but you're not able to breathe out. So you have a constriction here. There is a difficulty and you are breathless. So just imagine a situation and what the quality of life is for those patients. So with yoga therapy, the quality of life is also enhanced, and there are other positive outcomes, as far as we measured it. Role of yoga therapy in obstetrics and gynecology, OBG, which, plays a vital role in taking care of both the health of the mother and the baby, the progeny. So yoga has a very vital role to play, prenatal, antenatal, as well as the postnatal care. And these are a few of the publication. Again, this is work in progress. All that I'm, adding here, it is all work in progress. And we have done a few pilots. We are hoping that we will do a larger research study. And we are also hoping for multi-centric collaborative work in all this. So what were the findings that we had with the studies that we did with the, pregnant women? One is like they feel more relaxed and sense the fetal activity while performing pranava pranayama, especially in the makara phase. As the women, the pregnant women were chanting, but there was fetal, special movement that was happening with the fetus, especially while this was being chanted. And, we also found that the cardiovascular parameters of the maternal parameters correlated very well with the fetal parameters, fetal cardiovascular parameters. So again, we say that the mother and the baby are connected. These are few things which, reestablishes all these factors. And, all this, when the mother is more relaxed, when there is a feeling of, complete connectivity that is happening with the fetus, it actually enhances the placental circulation, which means there is more oxygen and more nutrition supplied to the baby and making the baby, the fetus, a healthier baby. So even in the womb, you can try to add up to that. So psychosomatic health again of the maternal and fetal unit was established here. So what is the role of yoga therapy in pediatrics? So here it is like, the children, the school-going children are under tremendous stress because of their, the activities that is happening in school, the tests and exams and all that. So we try to prevent a few of the problems that may happen in later. So as Maharishi Patanjali says, Heyam Dukkam Anagatam, where we try to prevent the miseries. So as a preventive aspect in children, it is very, very helpful also for emotional stability, because they are so volatile and, they throw tantrums and whatnot. And we have the good fortune of working with children with special needs. So in pediatrics, these are, something which is very, very close to us, and children with autism spectrum disorder. So these are something, which is very, very the need of the hour, I would say, and inculcating yoga therapy in this underprivileged population, we have found so many beneficial effects in them. So a few of these studies, and we have also ongoing thesis work in autism spectrum disorder, children with that, as well as in the care providers of the autism spectrum children with special needs. So these are a few of the work in progress happening now. We found that reaction time, which is, the stimulus is given and the response happens, which is very, very delayed in children with special needs. But with yoga, we found an enhancement, an improvement in the reaction time, which is an indirect marker of the working of your central nervous system, which is actually very, very delayed, but now it's getting enhanced. Both the auditory, the sense of, your response to sound, as well as the visual reaction time, your response to the light. So both of them were enhancing, which means the child is more agile and more alert. Usually they are a bit dull, but now the agility and alertness has been enhanced in these children, apart from the cognitive skills and the social skills, because they tend to keep to themselves. They're very private, but now they want to come out into the world. They want to interact with people. So all these are getting enhanced in children with autism spectrum disorder. So finally enhancing the quality of life in them and improving their overall health status also. And we also found significant change in the childhood autism rating scale, which is the scale with which they are rated. This child has this much of autism, the affectation is because of this much. So the rating is now done with this questionnaire, which we found an enhancing, improving effect accordingly with the scores in this questionnaire. So what is the role of yoga therapy? You may be wondering what we are doing, like with the surgical condition. But yes, of course, we do play a very important role here. The pre-op, before the surgery, to reduce the anxiety, the fear, the stress, that is going to be there, obviously. And during the surgery, to maintain the cardiorespiratory and the autonomic balance, because anesthesia is being given during the surgery. So this need to be regulated and normalized. And post-operative wards, we can go in and we give yoga therapy to those immediately after the surgery, the next day, even with the breathing techniques that we could do, which actually, we found that it facilitates the healing optimally, increases the pain tolerance in the post-op patients. And of course, there is, we can also prevent the other infections that happens post-surgery. So all these reducing the, the days that in which you stay in the hospital, which means so much less infection also. And the patient is happy to, get discharged and go back home earlier. So these are a few things where, in surgical conditions, yoga can be helpful. A few studies that we have done with the surgery department. We have done work with, the lymphedema patients, which is again a surgical condition, what is normally known as the filariasis. So what we found with these patients, different grades are there: grade 1, grade 2, grade 3, grade 4. Grade 4 is like highly, it's like too developed filariasis, where we cannot really do much, but of course, we can alleviate the suffering, the pain, and enhance the quality of living of the patients. But otherwise, what we found was there's a lot of immobility caused because of this. We found that yoga therapy enables the alleviation to alleviate the suffering due to the physical disability in lymphedema patients, which affects their quality of life. And it also enhances their cognitive function as well as the physical mobility. Slowly, their mobility is regained with yoga therapy. The stress, the mental depression, loss of interest in life due to the constant pain that they undergo and difficulty in walking, all these we found reduced significantly. And all these were also correlating positively with the grade, the age of the patient, and the duration of the lymphedema that they have had. And it is working very, very well. And we did in collaboration with the Vector Control VCRC, which is like we have an MOU with them, and we are trying to take this up further and implement it as part of their regular treatment regimen, because so much of benefit is happening in them. And in the chronic rhinosinusitis, this is a study which we did with the ENT department. Normally it is a surgical condition, but the conventional management that is usually done for the sinus, what we did was we included Brahmari pranayama along with the conventional management, and we found beneficial enhancement of all the symptom score, the headache, the allergic symptoms that were found with sinus. All these reduced very significantly in just 4 weeks, and it was maintaining that graph till 12 weeks. And even after that, as a follow-up, a few of them said that the attacks are not happening now. The frequency has been now reduced. So along with the conventional management, it is really beneficial to add such yogic techniques, which is really, again, medicine and our traditional therapy coming together for the holistic benefit of the patient. And with including the Brahma Mudra, another technique that we follow in yoga therapy, including that with the conventional treatment in physiotherapy, they found that reduction of pain with the neck pain. This was done with patients of neck pain, the cervical spondylosis. They found significant reduction in the pain improvement of the proprioception, the sense of where you are, the sense of the activities that you can do, all this improved, and your functional abilities up to which you can, the range of mobility as we call, all these enhanced. And, for those individuals with neck pain. And what is the role of yoga therapy in mental health? Of course, all of us know that Adi Vyadi, the psychosomatic effect, the benefits of yoga in as far as the mind goes. So mental health, we know we are able to manage or regulate our emotions better. The limbic system, the working of the limbic system, the HPA axis as we call, which makes you react, that is now becoming a little fine-tuned, and you're able to respond. You're able to use the neocortex better by including yoga therapy with your conventional medical treatment in the conditions in the psychiatric department. So these are a few of the studies which have been done in collaboration with the psychiatric department. And you can see yoga therapy happening in the wards, which is very, very beneficial. It's happening every day. 2 days are like alternate days in the male ward and in the female ward. Again, I don't have to, tell how important it is and how beneficial it is also. So the pent up emotions that we tend to store within are released, and releasing, letting go of all this is very, very important, because the other things actually fall in place and become better once you release all these tensions. Like, for example, your system. Sometimes, we have so many files stored in the system that it slows down. And whatever we want to add in there, we want to save something important. It's not happening because we have so much of unwanted data there. So what do? Shift and delete. That's it. You get it out of the system. So similarly, what we can do is with yoga, with release of all these unwanted things that we tend to store in our mind, subconscious, unconscious, all these tensions are released, for the betterment of the patients. And the other benefit is that the patients also do the practices with their family members who are there, who also have the equal amount of stress. It is not the, more than the patient, I would say, the caregiver is stressed because their routine is now affected and there is stress. What is happening to my close relative, or what is happening to my dear near relative? What is there? So there is a lot of stress happening in the caregiver. So along with the patients, the caregivers also do the practices, which is like, a win-win situation now. We found that there was a fall in the depression as well as the anxiety scores. Anxiety scores, there's an immediate improvement that can be found. But with depression, it is long-term. And there's a positive role of adjunct yoga therapy in reducing the craving in patients with alcohol dependency syndrome. That's a study which we did with the alcohol dependents in a health center, which was for the alcohol dependent candidates, the patients who were admitted there. And our assistant professor, Dr. Balaji, is working with them. And this again is a work in progress. You'll hear more related to this in future. So this is an ongoing study, like I said. And what is the role of yoga therapy in cardiology? So as a rehabilitative, agent modality, yoga therapy is very, very useful. The scientific publication that we have done, and again, re-establishing, like the blood pressure, the heart rate, all these. And we also found that the heart rate variability, there's a very good influence of yoga therapy on this. It needs to be good because when there is bradycardia, you have to enhance the heart rate. When there is tachycardia, you have to reduce the heart rate, which is like beating faster. So with knowing, with the knowledge of all the techniques that we are doing and what is happening with each technique, it's really appropriate that, you know, we can apply the appropriate technique to the proper patient and we find beneficial benefits also. So we have this baroreceptor activity, which is getting enhanced, which is normalizing the blood pressure, regulating the blood pressure in patients with high BP, the hypertensive patients. And pranayama also helps to reduce the pre and post load on the heart, which is like to maintain the better health of the heart, maintain the cardiac health. And it also prevents the micro and macrovascular complications in patients with the metabolic syndrome. So a few of them, the findings, again, all this is work in progress. With dentistry, you may be wondering like, what's yoga doing in dentistry? But tell me, you know, touch your heart and tell me, you see the dentist chair, don't you feel anxious? Don't you feel like, oh my God, do I have to go through this? There's a general sense with everybody that you feel. The anxiety that is related to the dentist's chair, you know, the stress that you have to go through. The waiting, the procedure that happens, you have to keep your mouth open for a long time. All this, you know, adding up to the anxiety and stress. So these are a few of the studies which we did with the dental college. You know, like these were a few studies which we did in, again, the children with autism spectrum disorder, and also in relaxing the patients undergoing root canal therapy, what is happening to them. The work in progress that we have now is in the tooth extraction. How is the status of mind and how can yoga therapy you know, step in to relax the anxiety? So what is the benefit of yoga therapy? The findings from all these studies, we found that, you know, the oral health of the children with autism spectrum disorder is a little low because their tooth brushing is not so good. So the traditional conventional method is the audio-visual pedagogy that is done. They are shown videos, they are shown pictures of how to do the toothbrushing, you know, every day. So with the audio-visual pedagogy, we also included yoga therapy to these children with autism spectrum disorder, and we found, you know, enhanced benefit in the improvement in the mean plaque as well as the gingival indices score, indicating better oral health in these children, which means it is an additional skill. Instead of depending on anybody for, you know, their mother or a relative to brush the teeth for them, they are able to do it themselves now, and they are doing it better than before. And in patients with root canal treatment, there's a reduced significant reduction in both the anxiety, the pain, and yoga plays a very, very positive role in the patient compliance also, and reduction of cardiovascular parameters as well as the derived indices in the RCT patients, and anti-inflammatory effect. So post treatment, usually, you know, it takes a longer time to heal because of the inflammation, but with yoga we found that the wound is healing quicker because of the reduced inflammation. So in oncology, which is like, you know, growing exponentially across the globe, lot of factors, you know, poor lifestyle, long working hours, stressful life, smoking, alcohol, everything adding up to, you know, promoting this increase in the cancer rates across the globe. So these are a few of the studies which I'm very, very happy to share that we did with Kaivalyadhama. So it was a residential camp which was conducted by Kaivalyadhama for the cancer survivors. And these are the findings that we came across. The cancer rehabilitation program expected to have, you know, like their outlook of life became more, you know, optimistic. They found hope with all this, and they felt empowered and in control of the situation, which means like, you know, they are feeling better, much, much better. And the follow-up, which was done for 3 months, those who really did the practices got better benefited better. But it was also found that before starting with the program, what their parameters was, and now it is much, much better, even though they did not practice. So yoga improves the emotional expression, the acceptance, reduces pain perception and discomfort in the cancer patients. And yoga therapy also enhances the well-being both mentally and physically, as they reduce the side effects because of both the disease itself and the other treatments like the chemotherapy or the other treatments that are given for this, post surgery, if it is a surgery case. And rehabilitative and palliative care. So both of them are significant in the cancer survivors. What we call as the chemo brain, like we were just discussing about it this morning, the chemotherapy resulting in a lot of clogginess, the fogginess that happens in the brain. So we found that, with yoga therapy, all this is coming down, the depression is coming down, and that's it. In community setting, this is the closest to our heart, my heart especially. I just love this, reaching out to the society, the community, reaching out to the underprivileged populations of the community, especially, like the children with special needs, the senior citizen, the elderly who are, like neglected, in hospices, in old age homes. And the third other special thing here is the transgender population. There is a stigma and they are kept in the fringe of the society. But we have worked with all these populations as part of the community, setup. And we found a few of the representative samples working in a hospice with, these elderly women who've been left there by their children. And, they are doing yoga, and so many beneficial effects were found in them. The first thing is like they got interest in living. What was found, like they were hopeless and there was no interest. Why should I live? I'm old. That's it. I just don't want to get out of the bed. So that was their mental status. And with yoga, so many benefits happen. A few of the studies that we did in these populations. And what was the finding? There was a new light, like which was shed on the physiological changes occurring after the Surya Nadi and the Chandra Nadi in geriatric population. The immediate effect of 27 rounds of these techniques was studied, and again, beneficial effects in them. Shortening of the reaction time, because as age progresses, the reaction time is delayed. So we found an enhancement in that. Again, like earlier we discussed, the alertness, the agility, which, one of the sisters who was a subject in the work that I did with the hospice women, she said like she was saved from a very, very fatal accident, which could have been as she was walking in the road. There was a motorbike which just speeded past her. And, earlier her balancing ability was not so good. And, the sound, the response to sound, he was coming so fast that she would have definitely, be alarmed and lost her balance and hit her head on the platform, which was where she was walking. And she said that now with yoga, I found a better balance and I was able to move away from that speeding motorcyclist, so that, I could save myself from a lot of what could have happened. So again, Heyam Dukam Anagatam, right? So all these, anecdotal, it may sound like a story, but that's the feel-good factor that we get out of all, the benefits that we find inculcating yoga therapy into the patients or into populations. And so they enhance sensory motor function. So they're able to move, the agility is enhanced, the ability to respond to the stimulus, the auditory stimulus was better. So a practical example was what I was just sharing with you. And with a single session, we found normalizing of the heart rate, blood pressure, other cardiovascular indices in both the senior citizen population and the transgender population. So both responded very well to all this. I beg your pardon. And it was suggested, like the open, non-hostile environment actually promotes a better psychosomatic harmony in these people. So we are trying to be inclusive and not exclude them because they are not useful. That's a taboo that is there. And decreased depression levels, increase in the self-esteem, decreased anxiety, like promotes a sense of purpose, a sense of hope. The woman, who didn't want to put her feet down from the cot, and now she is a volunteer helping all those orphaned children who are part of the campus. It's like from the Hospice of St. Cluny, which has a huge campus catering to all these people, the aged people, the children, orphan children, destitute women. So this lady who had lost all interest, she's now a volunteer helping all the orphan children, children with special needs, the children with handicap. She's helping them voluntarily now. So that is again, the feel good factor. So age-related disorders we find is getting arrested, slows aging. We all have heard about the telomerase, which is something which we have, fingers crossed, in future we'll be able to do more molecular studies also, and biochemical studies also. So overall quality is improving, their health status is improving, and this is the ongoing study here. So conclusion, I would just like to say that, evidence-based research is increasingly spotlighting the critical role of the traditional complementary integrative therapies that are facilitating these natural healing mechanisms from the individual, as emphasized by Hippocrates centuries ago. So it is more important that we know what sort of the person has the disease rather than what is the disease that the person has. So the yoga therapy is more on the individual than the disease. So that is the highlighting factor or the speciality of yoga therapy, because we are teaching them a few skills that helps them so that, like they get empowered by learning that, because they are doing it. They are a active part here. They are not just a passive recipient. They are participating and they get empowered. So yoga therapy meets each and every one where they are. Some may be in the ground, some may be in the crawling level, some may be, jogging and running so fast. So that may be the levels where they are. And there may also be a wrong perception. They may be actually at a crawling level, but they may think that they are running. So all this is, like something that we need to understand, we need to study. We have to either stoop down to that crawling level, or we have to stretch ourselves beyond our own comfort zone to that person who's running to catch up with them. So this is like where we go and meet them at their level, so that after that we can be a companion in their journey. So here in this journey, the seeker, the subject, the participant, the sadhaka is the master, and the therapist is a companion in this journey towards health and healing. As a mindfulness practice, yoga, we require that you are aware and in the present moment. You don't think about the past, which is, just adding up to your sadness, repentance. And you don't think about the future, which is adding up to your anxiety. Oh my God, what is going to happen tomorrow? What will I do for the next thing? Nothing. There's no rewind button. There is no fast forward button in life. This moment is real. This is reality. So live in the now with awareness and non-judgmental awareness. So that would be for the enhancement, the empowerment of all of us. So health is not just a solo performance. It is like a symphony. because we have all the systems in the body and we have all the different dimensions of the human being. You know, the physical, the physiological, the psychological, the intellectual, the spiritual, all these different dimensions. So it is like, you know, in a symphony, we have the percussions, we have the string instruments, all of them are tuned together. And if there is some note wrong in just one aspect, the whole symphony, the whole flow there is lost. So that is the same thing with our health, you know, like all these different dimensions are interconnected and interlinked and influence each other. So like a harmony, it is time that we start conducting our own rhythm to according to our desired rhythm, our desired, flow. We can rule it. You can be your own Mozart or Beethoven or Ilayaraja for that matter. So conduct your symphony and, get better for our own self and for the empowerment of the society on the whole. So this is a journey where we are empowering everybody and ourselves. The participation is active from the seekers and, we are just companions there. Just to recap, and it is time we embrace this new epoch of the healthcare, for it promises a healthier and a more empowered society. And, I would just like to end it up with what Walt Disney says. Walt Disney is a favorite for all of us. Like, who doesn't love the Mickey Mouse and Minnie Mouse and all those, characters that he created. He had said, if you can dream it, you can do it. So can we dream for something big? And yes, try to achieve or try to attain that. And yes, we can and we will. Are you all in this journey with me, with all of us together? I'm sure we can reach new heights. And thank you so much. I hand over now to...
Thank you.
Thank you so much.
Thank you so much, Dr. Meena, for that very excellent and exhaustive presentation, highlighting the different research works over the past decade and plus through what was CYTER and today the School of Yoga Therapy. And it's going down memory lane to think of many of the studies and the individuals who are part of it and all. There is a question from Anurag Jaiswal, who's asking, is there a difference between mindfulness and being aware? So it's an interesting question.
Mindfulness is being in the present now. Awareness is, I think you should have the awareness overall. Now, as we were discussing now, the mindfully doing an activity. If you are, stretching your hand up, can you do it mindfully? Are you breathing? Can you be more mindful about it? If you're not breathing properly, can you do it? Are you halting your breath? Is your rhythm in the breathing, is it okay? Have you, doing it properly? So all this creates the mindfulness. And of course, you have to be aware also. I would say both are interlinked. We need both the qualities.
I was also just thinking, it's quite difficult to separate them from the yogic perspective. Now, technically, the dictionaries may have different terms, but yogically, we use them quite interchangeably. But I think your example was quite nice that, lift your hands mindfully. Sounds nice in that way. And again, Swamiji's concept of awareness as multidimensional. Awareness of the body, awareness of the emotions of the mind, and then coming into that metacognitive zone of awareness of awareness. Which, the other day, I think it was either Dr. Ingan or Dr. Satya.
Ingan.
I heard that concept of, that meta state, or metacognitive state when we talk about that awareness of awareness, which is closest to what we would call samadhi in the yogic parlance. And again, it's these are terms which are difficult to define at times. and they'll have committees to sit and deliberate or defining them. But I think one thing which I would like before any questions come in is to especially point out that the work with dentistry, I think, has been a pioneering work, because and we have to credit our dental college for having that openness. So they approached us. It was not us approaching them. So I would say the work that has come out of there with oral hygiene and children with autism spectrum, and then our root canal. Before a root canal, can you mitigate anxiety through pranayama and some marmanasthanam kriya? And
Extraction. The extraction of the tooth, which is now
the tooth extraction, which is now going on. That's another one. So it is interesting that this is happening, and we are looking at a project in community dentistry also, where they're going to go into the community and see in a community-based program how it can work. These others were hospital-based, though the children with autism was in a special school. So I think that has been something very innovative and not really thought about. And all of this is only possible. We must always remember with gratitude our management here.
Yes.
Because if it weren't for them, we would not be here in this hospital. Because we are in a hospital setting, we have these chances to do this type of work. So yes.
So as you were saying, sir, the dentist, the institution, they approached us. But I would just like to put in that initial stages when the department was set in as a center, it is like we had to go to each and every department and tell them that we could collaborate. There is potentially something there, and we could do some studies, interdepartmental, interdisciplinary, which wasn't happening. But I would say that the psychiatry department and the dermatology department were the first ones who gave us the breakthrough, and after that, now it is like they come seeking to us. So that's the change in the whole of the equation now that's happening. So just to put it in.
And another thing that has driven most of this research is also the dissertations.
Yes.
Being in an academic institution, research is often driven by dissertations by students doing the post-graduation.
Yeah.
So it is again an advantage you get, which you don't get outside. That we have a student who's doing their masters in orthopedics, so yoga and back pain becomes a topic. They are doing masters in dentistry, so this became a topic. A master's in obstetrics, it becomes a topic. A master's in pediatrics. We have a master's student in pediatrics. So she's doing a school-based yoga program, which is natural for pediatrics. Plus it brings the yoga. So, I think this is an advantage that has come through most of our work. Rather than being some research project that we sit and say we are going to do research in yoga, I think, it's the ambience of the whole university that supports us.
Yes.
Which is something that we must always keep in mind. That we are not sitting here thinking we are going to do it. It's the university ethos.
Yes.
Which is why I think if people want to do this type of work, they need to get into a medical healthcare setting. Otherwise, it's going to be very difficult to replicate this type of work. And again, the multidisciplinary approach. You have people from pediatrics, from psychiatry, from obstetrics, from general medicine, from surgery, you name it and they are there. So I think it's a very good point. Devasena Miss, would you like to say something?
Namaste everyone. Namaskaram. So we're in a wonderful section. Again, sorry for the disturbance. I couldn't be fully here because of the situation here going on. And but wonderful work again, appreciating and all the way taking forward the thing. And the only thing my doubt is why this therapy, then music therapy, yoga therapy, the awareness, lot of influence for the people. here and there, but still why they couldn't get the people that are just usual communication, even a lot of confusion happening with the people. What's the cause with the people in the mind? Just the ordinary communication, even they couldn't take, and everybody, every place, they are just keep on confusing everything actually. Just I'm wondering any therapy for that, even general people.
We will,
Sorry.
that's a prospective study that you have given us input. Maybe in future we'll think about it, how to, what are the techniques to relieve this disintegration that is happening. The thought, word, deed, there's a basic disintegration. They are thinking something, they are saying something, they are doing something. So how can we bring the harmony in this? Of course, yoga therapy can be influential and can be beneficial. So you have given us, like an input, and let's see how to inculcate this in our future studies. And thank you so much, ma'am, for
Thank
your.
you. Thank you. It will be very so much helpful for the people to move or to do what they have to do or what they are ask them to do. Thank you so much.
I would like to request Mr. Ramanathan Appu to say a few words. I see you on the screen, so it's nice to see you. Yes.
Yes, sir. I am one of your well-wisher right from 2010, but unable to participate in person due to various aspects. Okay, sir. This mindfulness and awareness, highlighting Swamiji's topic of awareness is how you are aware. Ammaji has done one cap on Swamiji. Awareness is how unaware you are. So this is the answer for Dr. Devasena also. Devasena says that why you are not taking up this to a lot of confusion, because they are unaware. First, Ammaji's teaching should reach them. Then all other things will follow. ISCM is doing wonderfully well. Anandaji, under your captaincy, this is going to rock. In another 10 years, you will be at nodal center for the world. All the very best for the ISCM team. Thank you, sir. Thank you very much for giving me an opportunity. Meena, you did very well. I'm proud of you that you are my wife. Thank you so much, all.
Now we have got it recorded also. Thank you so much.
I'm not saying anything.
Meena ma'am, your session was really awesome.
Thank you. Thank you. Thank you so much.
I'd like to thank.
In the presentation, you have created a massive mask to all the thing. FDP team, thank you so much for this opportunity.
Thank you. It's like, like we are so happy that when we checked with all these faculty, eminent stalwarts from across the world, they immediately accepted and agreed to do this. And, the whole value of this FDP has gone up to such heights because everybody has accepted, and we are able to bring in the different aspects of what is happening across the world in this. In yoga therapy, in a medical setting, in a educational setting, in different settings. So that is thanking all the resource person for accepting to give their, to spend time with us for this faculty development program, and thanking again the administration and management of SBV for giving us this opportunity. So what is now the trend currently, to include all these complementary therapies along with the other modalities of treatment. SBV, the management, thanks to our Chancellor, Shri Rajgopalan sir, who thought about it, his far-sighted vision way back in 2010, when this was not even a concept. He had this, dream that he brought us into this in the middle of the hospital. We were sitting, and the journey, starts from there. So thanks again to everyone. We have more sessions coming up. I hand over now to Dayanidhi.
So thank you, ma'am, for the wonderful session. And thank you, Praseeda ma'am and Meena Ramanathan ma'am, for the wonderful session today. What we have And the next week on 8th, we are going to have a session. On 8th, we are going to have a session by myself, Sri Dayanidhi, Assistant Professor, School of Yoga Therapy, ISCM, and by Mr. Professor Dr. S.T. Venkateshwaran Sir, Head and Department of Yoga and Community Medicine, Government Yoga and Naturopathy Medical College and Hospital, Chennai. So we are happy to have you all for this upcoming session. Will be held on 8th June. That means Thursday, 10:30 a.m. onwards. So thank you, everyone. And I just hand over to Sir for few words.
Before we
conclude.
conclude, I would just like to remind everyone that 16th and 17th, we have the in-person event happening here at SBV. So those of you who are in Pondicherry or in and around Pondicherry are most welcome to join us. The morning we'll have from 6:30 in the morning, we'll have a mass yoga demonstration at the beach. And then we have excellent speakers that day and the next day. And in the afternoon, free paper presentation by young researchers who want to share the research findings. So we have a very nice gala extravaganza coming up. And also one more point is that this Thursday afternoon, evening rather, at Alliance Française, we have an event by our ISCM team highlighting yoga therapy, music therapy, and holistic wellness. It's a short program from 6 to 7, Alliance Française. All of you in Pondicherry and surrounding Pondicherry are most welcome. It's a free event. And one more small thing to remember this week is Saturday, we'll have a session of the FDP. All the other weeks, it was Tuesday, Thursday. But because we wanted to conclude on the 15th with the 16, 17 in person, we had to shift one session to a Saturday. So this Saturday, we will have the FDP also. So just to keep you posted about it a little earlier. So over to you, Dayanidhi, for concluding.
Thank you, sir. So now we can conclude with the Loka Samasta prayer. So just hands in Namaskar Mudra, slowly. Om Loka Samasta Sukhino Bhavantu Sarve Janaha Sukhino Bhavantu. Om Shanti Shanti Shanti. Om. So thank you. Thank you, everyone. Thank you, ma'am.
Sir. Thank you, Langon sir. Thank you, everyone.
Thank you. So we meet you again on 8th June by 10:30 a.m. 8th June. Sir, thank you.
Thank you, sir.